Okay, so I want to talk today a little bit about health and people's attitude towards health. I think people have a funny way of looking at it and can be quite irresponsible, actually. If you look at the most extreme example of this, my dad was in hospital. He had leukemia and he stayed at a specialist cancer hospital. And you wouldn't believe the number of cigarette stubs there were. When you went outside to the sort of, I don't know, like a chill out zone, they had benches there. And walking and around the bench was like walking through autumn leaves, when the trees drop their leaves. I mean, it was just, they were everywhere. I'm thinking, how can people who've literally smoked themselves to death take time off their chemotherapy to go and smoke a cigarette? It was unbelievable. But actually, we all do it to sort of less varying degrees. Even people that sort of think of themselves as quite healthy may actually not be that healthy. They may still be going to the doctors and all this sort of stuff. The fact is, your body needs 90 different nutrients. That includes minerals, essential amino acids, essential fatty acids, and vitamins. And you need all of them in your diet. Most people's diets, even if they're having their 5 a day, probably not got all of the minerals and essential nutrients. And if that's the case, you're going to be missing one of these. And over the years, the decades, you're going to be building up a nutritional deficiency of some kind. And then you're going to develop a problem, okay? You're going to get a disease of some sort, and you're going to end up in the doctor's chair. And what the doctor's going to give you is a pill or a drug or something which will alleviate the symptom and make the problem go away for a short period of time. But you're not actually addressing the root cause of the problem when you do that. And you're going to go back to the same diet that you had before and the same problem, and you're going to be back in that doctor's chair, within however long it takes. You'll be back there. So ordinary people are doing the same thing that these cancer patients were doing, just in a different way and over a different time scale. Factor in also the level of toxins we ingest. A lot of people drink alcohol, even if they don't smoke, they drink. Even the people that drink will drink cheap alcohol, which has preservatives and other chemicals in. I mean, if you are going to drink, I don't drink, but if you are going to drink higher quality alcohol that's not going to do as much damage. And people eat cheap chocolate, cakes, treats, sweets, meat with preservatives in, all sorts of things. They're building up toxins, loading their body up with toxins, and they're going to cause themselves problems in the future. Then they're going to go to the doctors, they're going to take the drug or the pill, and then they're going to go back to the same diet, you see? So even ordinary people are doing the same thing. If you look out in society, you'll see that people are getting sicker. There's high rates of obesity now, there's high rates of cancer, high rates of heart disease, and all sorts of problems. The only thing that's really changed in the last 50 to 60 years is the diet. It's the only thing. I find it interesting that people are blind to this, and I was blind to this until I started to meet people that thought differently and gave me different ways of looking at things. But when you really take a look at it, it's as crazy as those guys smoking the cigarettes on their chemo. If you did this anywhere else, people would think you're absolutely nuts. I mean, imagine you had a garden, right? And you never fed the grass, okay? You never watered it, you never fed it. For 10 years, it might look all right. I mean, it would start to slowly go downhill. It would start to get weedy, and it might start to get sort of yellow and not be as green as it was before. And then you call in like a grass specialist, right? And he sells you green paint and a paint can, and you spray the green paint all over the grass, and it looks okay for another 5 years or something like that. But the 5 years after that, it's even yellower than it was the first time. It's gotten worse because the underlying problem hasn't been addressed. So not only does he give you the green paint, but he gives you another thing which you have to inject into the grass, the green dye, to make it green again. So you do all this, okay, and then actually the green dye has some problem with it. It causes the roots to be damaged. So then the grass expert, he sells you like a root hormone, which you have to dig into the soil to repair the roots. But the problem with that is it dehydrates the plants. Then you've got to buy an extra plant hydrator. I mean, this is what medicines will do. If you're not addressing the underlying problem, you will still have it after you've taken the medicine. Plus, you'll have the fallout from the medicine. The medicine, while in some circumstances is very needed, it can cause damage to your body. And there's a reason that doctors give the course only a certain length of time. It would not be healthy to take an antibiotic or some drug and just take it for 10 years without stopping. So the clue there is the fact that the doctors only let you have it for a certain amount of time. That tells you it's not really good for you. And it's not solving the problem. And I think people need to start taking a look at this. And I read in the newspapers all the time that the NHS is overburdened, there's not enough resources, and the problem lies with the NHS. I don't think it does. I've been served by the NHS and they're always busy, and I don't agree with all the treatments they prescribe, but they do work extremely hard, and a lot of money is clearly being spent on the NHS. So the machinery and the equipment and the training that goes into it is colossal. I don't think the problem lies with the NHS. I think the problem lies with the people in this country that are eating and drinking themselves half to death, and they flop onto the hospital or the doctor's door and say, "Fix me." And then they go out and they do all the same stuff again. So what I think you need to do if you're out there is to educate yourself, find out the real facts about nutrition, and make sure you're getting what your body needs so that you can live a long and happy life for you and your family.